Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Now, the next surgery which can be done for carcinoma esophagus is actually an Ivor Lewis esophagectomy. Ivor Lewis esophagectomy can be done for carcinoma esophagus. Now, according to Ivor Lewis esophagectomy, here actually if this is the person. Right. In Ivor Lewis esophagectomy, we can do a midline laparotomy is done along with a right-sided thoracotomy is also done in the patient. So midline esophagectomy followed by a right-sided thoracotomy is done. So it is a double incision where we do a midline esophagectomy followed by right-sided thoracotomy is done. This is actually done for the tumors which are in the middle one third of the esophagus, and the transthoracic esophagectomy is done. So you are doing esophagus in the thorax. Okay, through the thorax we are doing esophagectomy by opening the thorax. So it is called as transthoracic esophagectomy is done. So this is Ivor Lewis esophagectomy.
thank you and thank you for watching.